Welcome back to the Clinical Singularity, where we explore how artificial intelligence is changing medicine, not in the future, but right now. Today's episode begins with something out of a sci-fi movie, a multi-agent AI system that just helped scientists discover a potential treatment for a major cause of blindness. But don't blink, we're going to connect the dots to your knees, your back, and yes, your golf swing. I'm joined by Dr. Deborah Westergaard, interventional orthobiologics specialist, Regenerative affiliate, and one of the physicians already working at the edge of this new frontier.
Thank you. And yes, this one's worth paying attention to, even if your eyes are just fine.
So, this artificial intelligence system is called Robin, right? Let's start there. What is Robin? And why is everyone talking about it?
Robin is a multi-agent artificial intelligence system designed to act like an autonomous research team. It's made up of 3 specialized agents. Crow, like a superpowered librarian. It scans thousands of scientific studies in seconds. Falcon, the analyst. It evaluates potential treatments and identifies promising therapeutic targets. Finch, the data scientist. It handles complex data like RNA sequencing and even generates figures for publication. Robin doesn't run lab tests itself, but it does everything else: hypothesis generation, experimental design, and data analysis.
And its big debut was in ophthalmology.
Yes, Robin recently identified a glaucoma drug from Japan, ripasudil, as a promising treatment for dry age-related macular degeneration, a leading cause of vision loss in older adults. It figured out that this drug might improve how retinal cells process waste by inhibiting something called ROC.
You'll have to help me out. Rock sounds cool, but I'm guessing it's not a band.
Correct. ROC stands for Rho-associated protein kinase. It's an enzyme that affects how cells contract, move, and interact with their environment. In many chronic diseases, including degenerative eye conditions and possibly even in arthritis and spinal degeneration, ROC is too active, which disrupts normal tissue maintenance. By inhibiting ROC, ripasudil helps restore balance, improving cellular cleanup and function. Robin made that connection on its own, and lab tests confirmed it.
That's wild. So the AI didn't just follow a path, it created one. And it's going open source.
Yes, Robin's code, data, and agent pathways will be released to researchers worldwide on May 27, 2025. That means any scientist or clinician with curiosity and a data set could start building on what it's done. And the full discovery is already available in a 2025 preprint.
All right. Now let's talk about joints. How could this type of AI help someone like me who's, let's say, trying not to age out of tennis?
That's where it gets personal and promising. Imagine this. You're coming in for platelet-rich plasma, PRP, or another regenerative treatment. An AI like Robin could take your lab results, genetic markers, microbiome profile, supplement list, even your smartwatch data, and use that to generate a personalized optimization protocol before we even start the treatment. It might recommend tapering non-steroidal anti-inflammatory drugs like Advil to preserve platelet function, correcting low vitamin D, adjusting your supplement timing, or removing inflammatory foods, modulating sleep or glycine intake to enhance matrix remodeling. In short, creating the ideal internal environment for your body to repair itself with a little help from us.
That's precision medicine, with a backbone.
Exactly. We already know that factors like alcohol, non-steroidal anti-inflammatory drugs, and blood sugar can impact outcomes. AI just lets us refine the equation. Think the right PRP dose, correct site, and the ideal conditions for your biology. Now, to be clear, Robin isn't doing this in orthobiologics yet, but it may be a logical next step.
You're affiliated with Regenerative, which has a large patient outcome database, right?
Yes, Regenerative has curated the world's largest database of orthobiologic procedures, spanning over 2 decades. Robin, or an AI like it, could potentially analyze patient databases to help continually refine and evolve protocols. The Regenerative database is already used in a capacity to enhance clinical care and outcomes currently. AI will not replace our experience, but perhaps enhance it.
Could this make randomized trials obsolete?
I wouldn't say obsolete, but it could make them smarter. AI allows for living trials, ongoing real-world evidence across thousands of patients, updated in real time. It's more adaptable and often more meaningful than rigid 5-year studies that ignore patient variability.
So, are you being replaced by a machine anytime soon?
That is unlikely, at least for now. You still need a trained physician to guide a needle under fluoroscopy, make split-second procedural decisions, and interpret what imaging and data don't show. AI can't currently replace the human touch or anatomical expertise. It just makes us better at what we do.
So, let me get this straight. A multi-agent artificial intelligence discovers a new use for a glaucoma drug, and suddenly, it's also laying the groundwork for smarter orthopedic care.
That's right. And if this pace continues, we're about to see a quantum leap in how we personalize regenerative care. Not hype, just smarter tools used by capable hands.
Well, that's the kind of future I want to be a part of. Dr. Westergaard, thank you. And to everyone watching, don't blink. Medicine's evolving fast. Stay sharp, stay curious, and we'll see you next time on the Clinical Singularity.